All right, welcome to Module 3 of the Bridge Qualitative Research Microcourse. This module will focus on qualitative evaluation processes. I'm your instructor, Brenna Bray. I have a PhD in biomedical science and neuroscience and postdoctorate training in complementary and integrative health that focused on qualitative research. My postdoc training was through the Bridge program. I was a Bridge R90 fellow. This course is also for the Bridge T90 R90 Fellowship postdoctoral training program, and its development was supported by a grant from the NCCIH. In this module, we're going to talk about qualitative evaluation processes. So we'll talk about determining inquiry purpose and focus, identifying key informants and data sources. We'll talk about data collection procedures, and we're really going to focus on semi-structured interviews, focus groups, document reviews, and how to identify sample sizes for analysis, design, and saturation types. We'll talk about data management strategies, trustworthiness protection practices, and responsible conduct in research. We'll have a quiz at the end of this module. It will include 14 questions, and it'll be worth 24 points, so 24% of your overall grade. We're going to really use section 3 of chapter 7 of Barrio, Minton, and Lenz's 2019 text that focuses on qualitative evaluation processes. We'll also pull from pages 6 to 16 in Lim's 2024 text, and we'll use Woodich's text on identifying sample sizes. And we're going to really focus on tables 1, 2, and figure 1. By the end of this module, you should be able to identify key sources of information and data collection that can be useful in qualitative analyses. You should be able to develop procedures for conducting semi-structured interviews, focus groups, and document analyses. You should be able to identify appropriate sample sizes for qualitative research studies based on analytic approach, design, and saturation preferences. You should be able to develop strategies for data management, identify procedures for ensuring data trustworthiness, and critique studies using qualitative methodology. And again, here's just showing you the quiz in the context of the whole course. This quiz will be worth 24% of your overall grade, so it's kind of the largest of the quizzes that we have. Let's get into it. So briefly, we can break qualitative evaluation processes down into a few components, and these are the components we're going to be covering in this course. We're going to talk about determining the purpose and focus of inquiry, identifying key informants and data sources, identifying data collection procedures, and we're going to focus on observations, records, and surveys, semi-structured interviews, and focus groups and Delphi panels. And here's just a little, so interviews, surveys, group discussions, and observations, which are kind of main types of qualitative data collection. Then we're going to talk about data management strategies, trustworthiness protections, and ethical protections. So when we think about determining inquiry purpose and focus, we want to ask, what do we want to understand, right? When we're just starting out in a program of research, we're going to engage in qualitative research. What are we asking? What are we wanting to understand? Usually with qualitative research, we're seeking to understand a pathology or a population or an intervention or a program or a policy or an institution or an organization or a consumer group or an experience or a phenomenon. So we want to ask, why do we want to answer these questions? And how will we use our responses or findings? Because how we want to use the data that we collect is going to determine how we collect that data and what questions we ask. So when we're thinking about how do we identify key informants and data sources, right? That's really something that is going to influence the data that we collect and how we can use it. So we want to have a think about how we can best access the type of information that we need to answer our questions. So we might ask, is it through people, right? Are people going to be the best informants and data sources? Do we want to be interviewing patients? Do we want to be interviewing providers? Or do we want to be interviewing experts? And then what type of sampling do we want to use? And in qualitative research, we tend to use more purposive sampling often. So we kind of have either more stringent inclusion and exclusion criteria, and we're really kind of focusing on a subgroup with a very strong intention. And usually that purpose or that intention is linked to the purpose of the inquiry, the reason that we're doing the assessment. Our sampling methods might include a wide range of strategies. So we might include typical and atypical or deviant cases, and we might use maximum variation sampling to gather broad perspectives. We might also collect data through records in addition to people. So then we want to ask which ones. Do we want to use medical or clinical records, school or agency reports? We might review intake records or interview new clients. So once we've identified our key informants, whether that's people, participants, providers, records, then we want to be asking who should be responsible for this data collection? Who's going to collect the data and conduct the research? So usually we'll be thinking about interview expertise. Does someone have experience in conducting interviews? We often might want folks who have strong interpersonal skills. Maybe we want them to have a familiarity with the focus phenomenon or population. And we might caution against having service providers collect this data because there might be a power differential there and they may have emotional ties with the client. So when we're using maybe program evaluations or, semi-structured interviews for research, we might not want to have the providers be the people collecting that data just to try to really remove all biases and mitigate that potential power differential. So once we've identified who we want to collect data from and who we want to be collecting that data, then we start thinking about how we're going to collect that data. So what specific methods should be used to collect data? And in qualitative research, we really center around semi-structured interviews, and that could be through telephone or virtual like Zoom or in person. We also use focus groups, and again, those could be virtual or in person. And then we tend to also include or collect data through observations, open-ended survey responses, so open-ended needs assessments, process evaluations, satisfaction estimates that we covered in Module 2, and existing documents. So this could include client files or agency reports. And we usually use guides or scripts for interviews and focus groups. So this is Table 6 from LIMS 2024 text, What is Qualitative Research? This table highlights data collection methods for qualitative research. So we can see here we've got archival methods, in-depth interviews, focus groups, and observations. And for each one of these, we've provided, or LIM has provided, a description outlining some strengths, some shortcomings, and some mitigating strategies. So archival research, we use this to analyze existing documents and records for research information. It includes traditional documents, so brochures, magazines, newspapers, and online materials. Some strengths of using archival data, it can provide rich historical content. There's an abundance of data. It's very cost effective. On the other hand, there can be a potential bias in the data. We might not represent the full scope of a desired data, and it tends to be very static, especially rooted in a specific historical perspective. So it can be almost have more of these quantitative properties, kind of gestaltian. Some mitigating strategies to mitigate those shortcomings, we might include contextual analyses to understand biases, and we might use a diverse range of sources to ensure comprehensive coverage. Now, when we're thinking about interviews, interviews are one-on-one conversations that explore a participant's insights on a topic in depth. Some strengths of interviews, they can provide detailed personal data. They can have flexibility in probing for information. They can have flexibility in timing, right? So an interview can be conducted from anywhere 30 minutes to 90 minutes or upwards. And they can uncover unexpected insights that we might not get if we're using maybe just more of a quantitative survey or even looking at archival data. Some shortcomings of interviews, they can be very time consuming, both to conduct and to analyze the data. They rely on often participants' memory and honesty, right? So we might have that participant bias. And there's a potential for the interview to have a bias as well. In order to mitigate those shortcomings, we might employ or train skilled interviewers. We might record interviews for accuracy and then transcribe the interviews and review the interview transcripts. And we might ensure a more neutral and comfortable interview environment. And we'll get into that in depth a little bit later in this module. Focus groups tend to be guided, have guided group discussions to gather attitudes and perceptions on a specific issue or object. Focus groups tend to be interactive. They have interactive dynamics that can reveal group norms. They can be cost-effective ways of gathering a range of perspectives, and they can stimulate rich discussion. On the other hand, groupthink and the moderator effect can skew limitations. Some participants can kind of dominate the discussion and influence others. The analyses can be very complex and they can have tight timing, right? So, for example, we might want to time something for about 90 minutes, and we'll have to coordinate everyone's schedule in the group. To mitigate these limitations, we might carefully moderate or manage group dynamics. We might limit group size to typically between 5 to 10 participants. And we might use or train skilled facilitators, and we might train them to encourage participation from all members. And we'll get into that a little bit more in this module as well. And then observations, we might just directly observe and record behaviors or processes as they naturally occur. This type of data collection can provide context to other data forms. It can reveal discrepancies between what people say and what people do, and provide real-time insights. On the other hand, the Hawthorne effect or observer influence can alter behavior. Observations can be time-consuming, and they may raise ethical concerns regarding privacy. To mitigate these limitations, we might use unobtrusive observation techniques, so distant observation or recordings. We might combine observations with other methods like interviews for comprehensive understanding. And we might ensure, we should ensure ethical practices, including informed consent where appropriate. So now we're going to dig a little bit deeper into these different data collection types, and we're going to start with semi-structured interviews. So these are one-on-one interviews. They're usually conducted in a conversational tone. They might include open and closed-ended questions, and then they'll often include follow-up probes to elicit a deeper understanding. Semi-structured interviews are appropriate when we're wanting to understand individuals' independent thoughts and when we want to protect anonymity and response authenticity. They provide one-on-one time with experts or providers, and they enable us to explore uncharted territory or puzzles. And there's a companion module here that I'll share some of my research, which use semi-structured interviews in experts in the field of binge eating disorder, both providers and researchers and healthcare administrators. Semi-structured interviews are important or can be helpful when we want to seek individual perspectives and narratives, when we want to seek personal and sensitive information, when we want to collect detailed, in-depth information, when we want to describe complex issues or processes, and when we want to access geographically dispersed participants. There are a few things that we want to think about when we're designing semi-structured interviews. So we want to think about the timing. Optimally, we want to keep our interviews under 1 hour just to ensure and really support participant engagement. We want to be really careful in our topic selection and in how we order our questions. So we want to order the most important questions first to kind of mitigate interview fatigue, and we want to ease into more sensitive topics. Just like a first date, right? So when we're thinking about how we might design our semi-structured interview, how we want to design the questions, we might think of it like dating 101, right? We want to keep it under an hour. We want to really be intentional about our topics, how we order them. We kind of ease into it, but we do have the most important topics right up front, right? Just like a first date. We want to open with pleasantries and close-ended questions. Oh, how are you? I noticed that you're wearing a shirt. Then we want to follow up with questions that are designed to understand nuances, right? So we kind of start by breaking the ice, and then as we warm up, we get into this kind of greater depth of our questions, maybe more sensitive questions. And that's where we're going to probe a little bit more and we're going to follow up. And really, that's those probes or those follow-ups are going to enable us to understand nuance. We're going to start with positive questions and then explore the limitations. And we're going to progressively work up to greater depth and relevance. And then again, we're going to ease into and out of our more sensitive questions or topics. And we'll usually include those in the second half of our interview. And usually I'd say the third, fourth of the interview. Again, just like a first date, right? We come in, we're pleasant, we're kind of have some small talk, some chit chat. We kind of ease into the, more meaty questions that we have, but we start with the positive aspects, right? We put our best foot forward first, and then we might kind of disclose some limitations or explore some limitations. When we're administering informed consent, there are a few kind of technological aspects that we want to think about in the context of qualitative research as well. So we might inform participants how and why they've been selected. We might do this in the informed consent verbiage as well as in the interview. We are going to inform them on how we will use their information and how we will protect their privacy. These are pretty standard. They'll be included in their informed consent verbiage as well. We might consider administering informed consent verbally during the interview. And if we do this, we might, we generally want to record all of our interviews so that we can have a record and kind of have that validation. And often, if we're conducting interviews anonymously, what we'll do is we'll start with introductions with the recording off. And then we'll start the recording after introductions to protect anonymity. And then we might administer informed consent verbally. So in my research, I've used this. So I might be talking to an expert, we'll kind of chit chat, and then I'll say, all right, I'm going to start the recording now. We're going to start the interview, and I'm going to start the recording. Is that okay with you? And they'll say yes. And then I'll start the recording, and I'll say, all right, I've started the recording now. This is an anonymous interview, so I just want you to be aware that we are recording this. I might ask you to try to protect your own anonymity and abstain from using disclosures that could be used to identify you. If you do, that's okay. We can modify the transcript and take those out. So we won't have any identifying information that were used when we're analyzing the data or publishing the data. They'll say, okay. And then I'll say, I'm going to just start by affirming that we do have your informed consent to be participating in this. You've read the informed consent verbiage. Do we have your informed consent? And then they'll either say yes, or they might say, no, can you please read me the informed consent? At which case we'd, re-administer that. And then we might get on with the rest of our interview. So a few more best practices for administering semi-structured interviews. We usually want to summarize the informed consent verbiage, even if they've already provided a written informed consent. We want to use non-directive language and listening skills, right? When we're asking our questions, we want our questions to be really objective, really open-ended. We're not trying to direct our participants to any particular responses. We want to communicate we want to communicate acceptance of both person and message. And we can validate a person, their experiences, and their message, even if they don't align with our own. We're not communicating righteousness, that someone is right or that they're wrong, but we're just communicating validation and that we accept their perspective and their response. We want to reflect understanding. Often we can do this by repeating back to an individual. So if I'm hearing you correctly, this is what I'm hearing. Is that correct? And then they can affirm or confirm. or deny or revise. And then we want to also obviously clarify any unclear statements. So if there's anything that arises for us that's not clear, the semi-structured interview format gives us the flexibility to probe and clarify. We want to also be able to discern when to probe and when to hold the broader focus, right? There are some details that maybe aren't super important. If someone is talking about, a very traumatic experience that they have, and they mention that they were wearing a red shirt, we don't want to probe and ask like, oh, what tone of red, right? That doesn't really matter. We want to hold the broader focus. And as an interviewer, that's where we really want to be able to discern what details are important and what aren't. And then at the end, we want to close our interview by summarizing key points that we've identified. We want to summarize how we will use and protect the data that we've obtained in the interview. And then we'll, address what next steps there are. So we might say, thank you so much. Broadly, here's what I'm hearing from you. Here's what we've discussed. Here's what we're going to do with this data. We're interviewing other experts as well. This is in my research where we're interviewing experts. We're going to analyze all the data for themes, and then we're going to publish those themes in several publications. At each step of the way, when we do publish the data, I'll send you an email or I'll be in contact with you. I'll provide you with a copy of that publication so you can, keep up on what's going on if you're interested. If you have any questions after this interview or at any time during this study, you can always contact me or one of the study administrators or the IRB, at NUNM, for example, which is where I was conducting my research. So here's a little sample semi-structured interview script. We might ask, will you tell me about your experience with this intervention? What aspect of this intervention did you like best? What aspect was most helpful? What are the biggest strengths that you identify of this intervention? What aspects of this intervention should be kept or retained and not changed, right? So we're kind of easing into it, starting with pleasantries, starting with the positive, and then we might ask, are there any changes that you've noticed that you associate with this intervention? What changes are most important to you? And then we might ask, what aspects did you like least of this intervention? What was least helpful about this intervention to you? What are the biggest weaknesses that you see of this intervention? Is there anything that you identify that should be changed of this intervention? Is there anything else you'd like to share with me about this intervention? And I always recommend ending with that very broad, kind of open-ended question. Is there anything I'm missing? Is there anything else that you'd like to tell me about your experience? So here is a little table from LIMS 2024 publication, What is Qualitative Research? And it identifies kind of some tactics for preparing and managing interviews. So in terms of the interview criteria, we want to have an objective setting. We want to think about question design, sequencing probing, moderating flexibility and timing, discussing management, closure and spontaneity, and pilot testing. So in interviews, in-depth interviews, we want to aim for an in-depth understanding of an individual or perspective. We want to use open-ended, flexible, semi-structured, or unstructured interviews that can allow for personal storytelling. We want our flow to have a natural conversational tone or flow. We want it to be tailored to the individual's responses for depth or sequencing and probing. We typically want one-on-one interviews, right? So they're focused on building rapport and trust. And that's kind of why we start with that more small talk and we ease into the more sensitive questions. This enables us to develop a rapport with the person who we're interviewing, establish some trust, right? And then we can walk them into those more sensitive questions and we can walk them out of those more sensitive questions. The length of interviews can be adjusted based on the depth of the response. And these interviews, semi-structured interviews, are usually led by the respondent, right? So we might have our script, but we kind of let them lead as well. And the interviewer can kind of follow that lead where they take us, and then we might go back to the script, right? Closure can be more reflective, summarizing individual insights. And we can pursue tangents that are individually relevant. These might be essential to ensure questions that elicit valuable insights. We're going to come back to this focus group section here, but for now, we're just going to focus on the in-depth or individual aspects. When we're preparing for semi-structured interviews, Lim provides a little toolbox of probing techniques. So we want to consider personal probing, which invites participants to share personal experiences and perspectives related to the research topic. We might use personal probing to gather detailed narratives and individual insights. And one thing that we want to consider with personal probing is that it ensures depth in understanding individual experiences, beliefs, and actions. But it does require sensitivity and rapport building skills. We can also use projection techniques. So these encourage participants to express thoughts and feelings indirectly by attributing them to others or objects. So we might say, I've observed others describe this. Have you experienced that? This can be effective in exploring sensitive issues or overcoming social desirability bias, but it needs careful construction to avoid leading questions and misinterpretation, right? When we're using projection techniques, we're not trying to lead a participant to give us a specific answer. We're just trying to offer an example to kind of help them identify in and again, overcome those kind of barriers that might be related to sensitivity or social desirability. So we want to be really careful that we're using this as an inviting tool, but not leading the responses. And then we might also use vignettes. So vignettes involve presenting participants with scenarios or situations, either brought by them or provided by the researcher. They can be useful for understanding decision-making processes, values, and norms. But again, they require thoughtful design to ensure their relevance and ethical considerations and ensure that we're not leading responses. Now we're going to switch over to focus groups. So focus groups are qualitative research methods in which small, diverse groups discuss a specific topic, product, or idea. Discussions are typically guided by a facilitator who encourages participants to share their opinions, experiences, and reactions. They're widely used in research and media to explore group dynamics, gather feedback, and uncover insights through interactive small group processes. And they focus on generating a range of options or perspectives. So they're really expansive rather than forcing a consensus or being reductive. So one point that I want to make here are, it could be easy to misinterpret focus groups and think, well, I don't have enough time to conduct 5 semi-structured interviews, so I'm just going to include all my 5 participants in one group. The purpose of a focus group is not to save time on interviews. The purpose of a focus group is much more nuanced, and it's really to understand the dynamics, right? How certain responses relate to one another, these group dynamics, right? So the data that one person might provide you in an interview where they have anonymity and they can have kind of greater authenticity in their responses might be very different than the data that that same individual provides when they're in a group setting, right? So focus groups can help us understand how these group dynamics might influence an individual personal experience, and they can help us identify the experience of a group as a whole. So when are focus groups appropriate? Like I said, not just, oh, I don't have enough time to do 5 interviews, right? They're appropriate when we want to assess needs, when we want to design interventions, when we want to evaluate policy options, when we want to pilot test data collection instruments, when we want to understand qualitative findings, and we want to monitor and evaluate agency options. They're also appropriate when we want to capture a range of views or experiences, when we really want to understand a group dynamic, when we want to discuss or explain issues, explore new issues, identify social and community norms, seek broad community level information, and observe group interactions. And Barrio Mitten Lens also offers some guidelines for focus groups, and these are somewhat similar to the guidelines for semi-structured interviews, but they're a little bit different. So we want to start with a sampling plan. Who's going to be in our focus group and how are we going to recruit them? Typically, we want to prioritize homogeneity in participant role, right? So we want to avoid power dynamics. If we're conducting focus groups of patients and providers, for example, we want to have one group with all patients and one group with all providers. So similar power level, homogeneity in that role or that power level so that we're not having power dynamics within a focus group. Wooditch offers some guidance on sample sizes for focus groups. They suggest that in order to attain thematic saturation, to really saturate all the data and understand themes and identify all the themes that are present, we want to have focus groups that are ideally between 6 and 8 participants. And the kind of ideal range would be 5 to 10 participants per focus group. We usually want to develop a semi-structured script. And in a focus group, we want to plan on the interview, or the experience taking about 60 to 90 minutes. And again, we really want to consider the question order, timing, and progression, same as we talked about when developing our semi-structured interview script. When conducting focus groups, we also want to attend to the process and process skills while facilitating focus groups. So when we're conducting or facilitating a focus group, we want to be really non-biased, but we want to be able to draw out equal participation, right? So if one person is really not contributing, we might kind of try to draw out their voice. We want to invite contrasting opinions and really facilitate discussion on that. And we want to remain supportively neutral, right? So we can affirm the individual and the opinion that the individual is expressing from a space of neutrality. So we're not affirming it as being right or dominant or wrong, but we're just affirming that it is there and we're validating it. We really want to be managing group dynamics and facilitating discussion rather than having kind of more of a question answer feel, right? So rather than just we read a question, go around the table and people respond, we really want to be facilitating engagement and discussion. And then again, we want to close with a summary of the major points of the group, how the findings will be used, how the data will be protected, and what the next steps are. So here's a sample of a focus group interview script, pretty similar to what we might use for semi-structured interviews. So will you tell me about your experience with this intervention? What parts did you guys like best? What was most helpful? What were the biggest strengths? What should be kept or retained or not changed? Are there any changes that you've noticed that you associate with the intervention? What changes are most important to you? What did you like least? What was least helpful? What are the biggest weaknesses that you see of this intervention? What should be changed? And is there anything else you'd like to share about this intervention? Now, the script is inherently the same script that we offered for semi-structured interviews. With focus groups, you're going to want to plan on having a lot more discussion in these questions, right? And so you're really kind of narrowing that journey. Navigating or supporting that journey. Now we're going to talk about document review, our kind of third main type of data collection. And I think that's actually the last type of data collection that we really address here. Yeah, it is. Okay. So what does document review entail? Usually it entails a systematic review and interpretation of written or visual materials to uncover insights, patterns, and themes related to a research question or topic. What types of documents can be reviewed? We can review texts, so this might be books, articles, reports, letters, diaries, visuals, so this might include photographs like those stories of New York, illustrations, advertisements, records, so meeting minutes, official documents, transcripts, media, so social media posts, news articles, or recordings. And here's an example I pulled from the literature. This is Nutley et al.'s 2021 publication on the impacts of the COVID-19 pandemic on disordered eating behavior, a qualitative analysis of social media posts. So here I've just got some basic information from this publication. So they say a growing body of evidence is suggesting a significant association between the COVID-19 pandemic and population-level mental health. Study findings suggest that individuals with a lifetime history of disordered eating behavior may be negatively affected by the COVID-19 related anxiety, and prevention measures may disrupt daily functioning and limit access to treatment. However, The data describing the influence of COVID-19 pandemic on disordered eating behaviors are limited, and most findings focus on individuals in treatment settings. So the aim of this study is to characterize the experience of Reddit users worldwide who post in eating disorder related discussion forums describing the influence of COVID-19 pandemic on their overall mental health and disordered eating behavior. So rather than using semi-structured interviews here, they're looking at Reddit posts. The data were collected from popular subreddits acknowledging eating disorders as their primary discussion topic. Unique discussion posts dated from January 1st to May 31st, 2020, that reference the COVID-19 pandemic were extracted and evaluated using inductive thematic data analysis. So this is a great example of a use for qualitative research, right? We've identified this gap. We've got the COVID-19 pandemic going on. We know that this is impacting folks' mental health, especially folks who have lifetime mental health diagnoses or issues already. And one example would be eating disorders. Now, with binge eating disorder, which is the most common type of eating disorder, we also have data showing us that about 95% of folks who have binge eating disorder never receive a formal diagnosis, and 95% also don't know that they have an eating disorder. So that is kind of a limitation in the field. And so what Dr. Nutley and colleagues did to kind of get around that was they looked at Reddit data on eating disorders, right? You don't have to know if you have an eating disorder to be able to get this data. So here we've got their methods. Reddit, an internet-based social media platform consistent of news stories, web content ratings, and discussion communities, has been denoted as a valuable tool for collection of high-quality psychological research data. So others have used this data before. This web-based forum is divided into communities of registered users expressing interest in unique discussion topics, or subreddits. In this analysis, data were collected from 3 popular subreddits that acknowledge eating disorders as their primary discussion topic. And here's the Reddits. Eating disorders, which has 43,500 members, anorexia nervosa, which has 19,200 members, and binge eating disorder, all one word, which has 35,700 members. Unique discussion posts dated from January 1st to May 31st, 2020, that reference the COVID pandemic, i.e., containing one or more of the keywords coronavirus, COVID, quarantine, or pandemic, were extracted using the R Reddit Extractor R package, or R project. In addition to the title and content of the public posts, the username of the posting entity, posting date, and number of reply comments were collected. Only the initial posts and not subsequent replies were included for data analysis. All discussion posts were written in the English language, thus language-based inclusions were not applied. As this secondary data analysis is limited to publicly available web-based content, this research was determined by the University of Florida's IRB to be exempt from human research review, or human subjects review. Although the discussion threads are publicly available, usernames have been omitted from this report to protect user anonymity, right? So they've got a very thorough plan of their data collection, right? So it's very methodical. This really helps add validity to the work, and I think that's really important. And then they've also got a very thorough description of their statistical analyses. I'm not going to go into this, but it is here if you're interested. So then reporting the results. I'll start by reading the abstract here. They're telling us 6 primary themes were identified: change in eating disorder symptoms, change in exercise routine, impact of quarantine on daily life, emotional well-being, help seeking, behavior, and associated risks and health outcomes. Now, in Module 4, we'll actually get into kind of the processes that can be used to identify themes like this. Here, I'm just kind of giving an example of what they found and how we start to kind of look at how we report our findings. So the majority of users reported the COVID-19 pandemic and associated public health prevention measures negatively impacted their psychiatric health and contributed to increased disordered eating behaviors. Feelings of isolation, frustration, and anxiety were common. Many individuals used Reddit forums to share personal experiences, seek advice, and offer shared accountability. So that's the abstract. And here are the results. We're going to start with kind of reporting on demographics, right? So in total, we identified 33 relevant posts from 33 unique users in anorexia nervosa, 180 posts from 172 users in the binge eating disorder subreddit, sorry, and 92 relevant posts from the eating disorder subreddit, which was a restricted subreddit, and so username and count were unknown. These were published between January 1st and May 31st, 2020. Collectively, the post consisted of 66,877 words. The posts were approximately 250 words in length and received between 1 and 73 replies, with a mean number of comments of 6. And then the themes are reported. So that's characteristics and discussion of posts, right? So this is, again, how we kind of validate our work. 6 primary themes were identified. And again, these were change in eating disorder symptoms, change in exercise routine, impact of quarantine on daily life, emotional well-being, help-seeking behavior, and associated risks and health outcomes. The primary themes comprise subordinate themes or secondary themes as detailed in table S1 in the multimedia appendix, right? So we're including tables with a lot of our data in them. And then I just want to give an example. So as they go on to report, they've got their main theme, change in eating disorder symptoms, which was theme number 1, we can see right here. And then they've got these sub-themes. So increased eating disorder symptomatology was a secondary theme, and then decreased eating disorder symptomatology was another secondary theme. And here they kind of describe each secondary theme and they give quotations or examples. And I think that piece is really important. So, in increased symptomatology, they say users often experienced a worsening of eating disorder symptoms corresponding to the onset of the global COVID-19 pandemic, with limited opportunity to leave the home or engage in personal and social activities as a result of quarantine and social distancing guidelines in 2/3 of posts. Right? So that's one little kind of mini sub-theme is the inability to leave the home that came up in 2/3 of posts. So they're kind of quantifying it, right? We've got a ratio of all the posts, how many address this, and then the percent. Users struggled to ignore obsessive thoughts related to food and weight and to refrain from engaging in disordered eating behaviors prompted by loneliness, anxiety, and boredom. And then they're going to give us some examples. For example, users with self-reported binge eating disorder often described quarantining at home as being, quote, surrounded by food, and described, quote, feeling as if they wouldn't be able to control themselves around all the food. Additionally, many users with ongoing eating disorder symptoms relied on increased frequency of compensatory behaviors, so restriction or purging, to cope with changes in their day-to-day routine induced by the pandemic. One user wrote, quote, I feel like since I'm not going to be walking and active as much, I need to be even more diligent with calorie counting, etc. Some users who described themselves as recovered or in recovery sought comfort in a time of heightened emotional distress by engaging in eating disorder behaviors previously associated with feelings of comfort and control. These users found the newly implemented COVID-19 restrictions to be very disruptive to the recovery mindset and other recovery-oriented processes. One user who described themselves as currently in recovery stated, quote, quarantine has given me too much time to think about my loss of control and all of the negatives I've held against myself over the years. As the days go on, I feel myself slipping into loneliness, depression, and anorectic tendencies. For a small number of individuals, disordered eating behavior was not present prior to the pandemic. These users primarily sought to gauge the severity of their diet behavior and their newfound anxieties related to food and weight. Quote, with this quarantine going on and everyone in my country are required to stay at home, I didn't get the chance to exercise. I lost control, ate a lot of snacks, and every time I weigh myself, I see the numbers fluctuating. I started to restrict even more. I stopped having my dinners and I purchased weeks worth sick of meal replacements. I just wanted to get to the weight I at least liked myself in. So that's some heavy content. If any of that feels activating for you, I invite you to, pause and engage in whatever self-care you might want. Maybe you might want to place your hand on your heart, engage in a little 3-minute meditation. I should have given maybe a content warning on this, an activation warning. But the point that I want to make here is they identify the main theme and subtheme. They kind of give a description of the theme, and then they're providing some quotations that support the theme. We'll get into this more in Module 5 when we talk about reporting, but just wanted to give an example of that. And this is just by using, Reddit documents. So document review can be really a rich source of data. Again, what type of documents can be reviewed? We talked about broadly, so kind of text, visuals, media. For clinical folks, so providers, we can use client records, intake reports, case notes, etc., weekly group sessions, reflection forms, group meeting notes, records, transcripts, supervision notes for staff members, and incident reports like group home and residential. Why might we want to include documents in our reviews? We use documents to enable greater understanding of contexts, meaning, and significance. So, like the significance of the document context, just like in the Reddit example, or to integrate with other qualitative methods, right? So, we might use documents to supplement an interview or observations. Or we might trace historical developments and explore cultural narratives or gather perspectives on a particular event or phenomenon that we can't capture in just an interview setting or a focus group. So some guidelines for document review, of course, we want to get IRB approval, or we want to think about if IRB approval is needed. And that'll vary depending on the type of documents that we're reviewing. Obviously, if we're trying to review medical documents or clinical documents, we are going to need IRB approval. We're going to need informed consent and express permission. If we're doing something like reviewing Reddit or public documents, we might not need that. We want to identify how to access the information that we're seeking. So are we going to access all records that are entered during a specific time period? In the Reddit example, they had a very specific date, right? It was like May through January of 2021, or January through May of 2021. Are we going to address only records with specific outcomes? So maybe only with a specific medical diagnosis or referral, or in the Reddit case, right, they had 3 very specific subreddits and very specific kind of word inclusion criteria. Or are we just going to kind of do random selection, right? So when we're using qualitative analysis, we still want to be very intentional in our data identification, our data collection, our inclusion and exclusion criteria. And when we're using documents, that would apply, rather than to a participant, that would apply to the documents. So going back to LIMS Table 6 on different kind of criteria, if we come down here on observations, again, they can offer direct observation and recording of behaviors and processes as they naturally occur. They can provide context to other data forms, reveal discrepancies between what people say and what people do. And real-time observation. Sorry, this is observation, not documents. So observations is kind of the last way that we can collect data. We want to be mindful of the Hawthorne effect or observer influence that can alter behavior. Observations can be time consuming. They might raise ethical concerns regarding privacy. We want to use unobtrusive observation techniques, maybe distant observation or recording. We want to combine them with other methods like interviews for comprehensive understanding. And we want to ensure ethical practices, including informed consent where appropriate. So these are our kind of main types of data collection that we've gone over. So archival, document review, in-depth interviews, focus groups, and observation. Now I want to take a moment to address sample sizes. When we're doing quantitative research, we can conduct a power analysis to identify how many participants we need to include in our research to have statistical significance in our findings. When we're using qualitative research, that's not always as simple, right? We know that we're going to be using smaller sample sizes. So how many participants do we need? Well, Wooditch, Beresford, and Bernard offer some guidance on sample sizes for 10 different types of qualitative data analysis. They offer an integrative review, empirical guidance, and next steps in their 2024 publication. So we're going to go over some of what they offer. In Table 2, they identify 5 types of qualitative data analysis and provide empirical recommendations for minimal sample sizes. Now, I should have pulled up the whole article here, but I'm not going to address their methodology, but they did a systematic review of data to identify how many participants or what sample sizes are needed to achieve different types of saturation. So in Table 2, we're looking at reflexive thematic analysis, ethnography, schema analysis, qualitative content analysis, and classical content analysis. They're going to outline the purpose of each of these, and we've kind of gone over some of these. So reflexive thematic analysis is an integrative process. We'll get into this one more actually in Module 4. It's an integrative process to identify themes in data and reflexively interpret thematic meaning. Ethnography can be used to describe culture, including its content and structure. Schema analysis can identify mental or cultural models. Qualitative content analysis is a systematic approach for categorizing and interpreting themes and contexts in qualitative data. And classical content analysis is a systematic approach for coding and comparing qualitative data. They kind of identify fields of origin for each of these, and then they identify minimum sample sizes. So in reflexive thematic analysis, there's no specific minimum sample size, but there is a price model that can be used to establish saturation. And we're not going to go into that one too much, but it is in this publication. For ethnography, the minimum sample size is going to be based on the theme or the level of data saturation that you want. So if you and the type of data that you're collecting. So if you're reviewing documents, you're probably going to want to review between 50 to 81 documents from interviews and observations. And if you're based on cultural consensus analysis, you're going to want to include 20 to 30 reviews. Schematic analysis, there's no minimum sample size. Qualitative content analysis, this can actually be determined by information power or a power analysis. And then classical content analysis can also be determined by a power analysis if you're going to want to run statistics on your findings. Oh, and then there's some more guidance there. Now, the table that I find to be really meaningful and helpful in Woodich's publication is actually Table 1, where they identify 5 types of saturation and provide empirical methods for minimum sample sizes. So the 5 types of saturation are 1, thematic saturation, which can be used to establish the number of interviews. The purpose of their analysis would be to establish the number of interviews needed to identify a high number of themes, right? So thematic saturation, are we identifying all of the themes that are there? And the minimum sample size that we're going to need for this are 9 interviews or an average of 12 to 13 interviews. And if we're conducting focus groups, we're going to need a minimum of 4 focus groups with a mean of 5 to 6 different focus groups. So not 4 participants in the focus group, but 4 focus groups total. If we're looking to saturate meaning, so capture all the variants of the meaning within a theme, and we want to establish the number of interviews we might need to capture that theme, we're going to need a minimum of 24 interviews if we want to really understand the nuanced meaning within a theme, and we're going to need a minimum of 8 focus groups. Meaning saturation is something that we're going to use more in the public health field, the allied health field, so complementary and integrative health, and medical anthropology. Skipping back up, data saturation is something we're going to want to use pretty much in all qualitative research, but especially in nursing, public health, and anthropology. Meta-theme saturation is going to help us identify all cross-site themes in a cross-cultural or multi-sited data set, as well as common within-site variants for each theme. This is going to be used in cross-cultural research and anthropology, and we're going to need a minimum of 20 to 40 interviews per site. And then salience saturation is going to help us identify items or themes that are most culturally important or salient to the interviews. So when we're trying to understand value, importance, weight, salience, we use this in medicine and anthropology. If we're using, usually we'll use kind of lists or transcripts or written data, and we're going to want at least 10 if exhausted, if the lists and questions or transcripts are really thorough or exhaustive. And then for theoretical saturation, if we're wanting to identify all major themes, their meanings, their variants, and the interrelationships among them, we're going to want to use interviews, and we're going to want to use between 20 to 30 interviews for that. And this is a very large schematic that looks maybe a little bit overwhelming. This is figure 1 in Woodich's text. And kind of got it blocked here, but it's showing a flow chart to help researchers determine sample size estimates for iterative multi-stage research designs with qualitative research. So we start with the question, what sample size is adequate for your goals in analyzing your qualitative data? Go through this flow chart to determine what sample size guidance exists, if any, for the qualitative analysis you are planning. You can go through this flowchart multiple times at different stages of your study if you're planning an iterative multi-step process. So we start by asking, is identifying a list of themes your purpose in analyzing your qualitative data right now? If yes, okay, you're creating a list of themes from qualitative data. Did you collect free lists? Yes or no? If we did, then we're going to need 10 free lists, if exhaustive, based on saturation and salience. If we didn't collect free lists, then we're going to need thematic analyses. So we're going to need 9 to 17 interviews or 4 to 8 focus groups based on theme data saturation. If we didn't identify lists, okay, you are doing something more than just creating a list of themes. Is your main analytic goal right now to richly describe the themes? If yes, okay, you are richly describing themes. Is your approach primarily reflexive? So are we going to look at the data, kind of identify themes, and then go back reflexively? If yes, then we're doing reflexive thematic analysis. So there's no formal empirical guidance on the sample sizes that we need, but we're suggested to use the price model to assess saturation. If our data is not reflexive, then we're just using standard thematic analysis, and we're going to want about 24 interviews or 8 focus groups based on meaning saturation. If we're doing, if our main analytic goal is not to richly describe themes, okay, you are doing something in addition to richly describing themes. Are you comparing themes? If we're comparing themes, then we go to yes. Okay, you're comparing themes. Is your comparison a cross-cultural thematic analysis? Cultures are groups with shared knowledge, beliefs, or values and behaviors. If yes, then we're doing a meta-theme analysis. If we're going to compare themes in different cultures, we're going to need 20 to 40 interviews per site based on meta-theme saturation. If not, okay, you are making comparisons across groups. Will your study generalize to population? Groups can be, for example, categories of gender, ethnicities, or political systems. If yes, then we're doing a classical content analysis and we need to use a censor or do a power analysis. If no, then we're doing qualitative content analysis and we need to assess information for power. Going back up, if we are not comparing themes, okay, you are not comparing themes. Are you building models? Building models is about describing how themes relate to one another. If yes, okay, you are building a model. Is your model about schemas, mental models, or norms? If yes, we're doing a schema analysis and there's no empirical sample size guidance. If not, then we're doing grounded theory and we're going to need 20 to 30 or more interviews based on the theoretical saturation that we're trying to achieve. If we're not building models, okay, you are analyzing cultural processes, context, etc. You're engaging in ethnography. You're going to need about 50 to 80 data documents from interviews and observations based on theme data saturation. And you're going to need about 20 to 30 interviews based on cultural consensus and analysis. So this is figure 1 in Woodich's 2024 text, sample sizes for 10 types of qualitative data analysis. And again, here's that text. Now we're going to talk about data management. This is kind of the last section of this module. We're going to talk about data management and trustworthy policies, as well as some research conduct. Responsible conduct in research. What is data management strategy? In this figure over here, we're seeing it includes data collecting, data organization, data storage, data processing, and data protection. So once we have that data, what are we going to do with it? Qualitative data are rich, complex, and messy. And an active data management strategy is critical, not just for how we're going to collect and store and protect the data, but also how are we going to organize it so we can analyze it. So recording and transcribing our recordings tend to be central, especially for semi-structured interviews and focus groups. We want to record them and we want to transcribe them. For anonymity, again, we want to start recordings after introductions, and note-taking can be used as supplements, but it should be planned in advance. We want to have a plan for how we're going to take notes during an interview or during a focus group, and we want to have that plan before we start, so we're not trying to figure it out on the fly. This can ensure that we have good notes that are well organized and really ones that we can use after the interview or the focus group. One suggestion is to use the interview script to organize or structure our notes. So for semi-structured interviews, we might want to use the interview script. For focus groups, we might ask participants to generate notes on a whiteboard that we can then take a photograph of or save or document with photographs. We might include a co-facilitating note taker to record responses if not recorded formally. So maybe someone who's attending the focus group who is just taking notes, or maybe we might offer a page to each participant and ask them to take notes on it and then collect that page. For document review, we want to decide whether to analyze documents or records as a whole or use shorthand note-taking strategy. So example, we might complete a half-page or a two-page worksheet for each document that we review, then review those notes. Moving on to trustworthiness protections, we want to provide evidence that our findings are accurately captured and accurately capture participants' experiences, and that our conclusions were generated with rigor and credibility. So transparency in our methodology is really important. It's what lends validity and trustworthiness to qualitative research. Levitt et al. Have a publication that provides some recommendations for designing and reviewing qualitative research in psychology that promotes methodological integrity. And we're going to kind of go through some of what they offer. So they offer some qualitative strategies for fidelity and utility. They suggest prolonged engagement in the data, negative case analysis, triangulation of data sources, so using interviews as well as focus groups and documents, including auditing trails, so having others audit our work, peer debriefing, and member checks. And they provide this really great figure. This is actually, sorry, not them. This is from Lim's 2024 publication, What is Qualitative Research? Provides this really great figure, a tree of trustworthiness. So we can see here, trustworthiness includes 4 key components. It includes credibility, and this is how we maintain internal validity in qualitative research. It's authenticity and believability of the study's findings that ensures the findings genuinely reflect the phenomenon being investigated. And credibility includes prolonged engagement, so spending extended time in the field to gain an in-depth understanding. It includes persistent observation, so focused, detailed observation over time to uncover deeper insights. It includes triangulation, so using multiple data sources, methods, or theories to cross-check findings. It includes member checking, so involving participants in verifying the accuracy of findings, right? So engaging, really checking reflexively. It includes peer debriefing, so engaging peers or mentors to review and challenge the research processes, right? We don't do this alone, and we'll get into that more in Module 5 when we discuss consensual qualitative research. Maybe that's Module 4. Yeah, it's Module 4. It involves negative case analysis, so analyzing cases that contradict common patterns to ensure a balanced view. And it includes referential adequacy, so saving a portion of the original data to compare with final interpretations. So that's credibility. Trustworthiness also includes dependability, and this is how we ensure reliability of our findings. So this is consistency of the research findings over time. And we really use primarily triangulation to ensure dependability and reliability. So we're using multiple data sources and methods or theories to cross-check findings, and audit inquiry. So having an external evaluator review the research process and decisions. Trustworthiness also includes confirmability, and this is really how we maintain objectivity in qualitative research, which is hugely important to its validity. So we maintain an impartial or neutrality, impartiality. Let's try that again. Qualitative research maintains impartiality or neutrality of the research, focusing on the extent to which findings are shaped by the data and not researcher bias. To do this, we use triangulation, member checking, and peer debriefing, as well as an audit trail. So documenting the research process in detail for external review and validation. And that feeds into audit inquiry, which I forgot is also part of dependability, having an external evaluator review the research process and decisions. Confirmability also involves reflexivity, so reflecting on and documenting the researcher's assumptions and biases. And then the last piece of trustworthiness is transferability. So this is that piece of external validity or generalizability. It's the extent to which the findings can be applied to other contexts. And here we want to really use thick descriptions, so providing detailed contextual descriptions of findings for applicability assessment. And I would add that external validity and generalizability tends to be an area where qualitative research has greater limitations. So I think transparency is a really important piece of this as well. We want to be transparent in our methodology, in our validity, in the length of our engagement, how persistent our observations are in the different sources that we use to triangulate our primary research. We want to be transparent in our auditing processes, in our reflexivity, in our peer debriefing, if we do use any negative case analyses, and in the extent to which our findings can be generalized to a greater population or subpopulation. So now we want to address trustworthiness safeguards. In order to ensure trustworthiness, here's a few steps that we can take as researchers. One, we want to stop and spend some time reflecting on our own experiences and expectations related to a topic before we collect data on that topic. We want to do this so that we can identify our own potential biases. For areas where we have stronger biases, we might want to think about outsourcing for topics with stronger biases. We might want to collaborate with 1 to 2 colleagues on data analysis. We want to consider when we're coding. We want to have considerations around our coding. We want to be aware of our own biases. We want to ensure common consensus regarding all findings. And we'll get into this a little bit more in Module 4 when we talk about consensual qualitative research, but that consensus is really important for maintaining objectivity and minimizing our own research biases. And then we want to, again, consider peer auditing or reviewing original documents. And that's, again, to support this consensual process. So in this step, I want to go back a minute. In this step, reflect on your own experiences and expectations related to your topic before collecting data. One thing that came up in my research when I was interviewing experts on binge eating disorder and environmental factors that experts associate with binge eating disorder, weight bias was a topic that came up among experts. So here's a quote that I included in my 2022 publication, Binge Eating Disorder is a Social Justice Issue, from one of the experts. They said, quote, weight bias affects researchers and clinicians in the field of eating disorders in the same way that it affects everyone everywhere. I thought I was not weight bias, but somebody who focuses on weight bias professionally said to me, well, of course you have weight bias. Everyone has weight bias. So I thought about it and I realized I do have weight bias. It's so much a part of the scenery that you don't even recognize how much it affects how you perceive things. I think there's a lot of people who don't recognize that. So this is just one example. If you're working in a field that involves weight, or eating disorders, metabolic disorders, overweight or obesity, as researchers and or as clinicians, we really want to be aware of what our own biases are. That can help us ensure the safety of the participants or the patients that we're working in. It can also help us ensure the validity and credibility of the work that we're doing so we can account for our own biases, be aware of our own biases, and if needed, validate our own biases to those who they may have harmed. And lastly, we want to address ethical protections. So here we've got just a nice kind of schematic of a few really important ethical protections. Of course, we want to protect participant safety. So some of the ways that we can do this, we can develop our own biases. We can review our our semi-structured interview transcripts or our focus group transcripts for participant safety. We might have a few, pilot participants go through our interviews, make sure that the content isn't too activating. If we do have activating content, that we have an activation warning, that we're handling that content with sensitivity, both as we walk into it and as we walk out of it. We want to take all practices to maintain scientific integrity. So transparent methodology, which we kind of talked about in this module, and we'll get into in module 4. Of course, we want to uphold human rights and dignity. We'll have IRB approval. We want to ensure social responsibility. We want to build trust in research and institutions, right? There's a lot of rupture in research in populations that research have engaged in, and it can be a social duty to seek to repair that through rigorously transparent and ethical research processes. And of course, we want to comply with legal and regulatory policies as well. So to do this, we want to preview all proposed procedures for ethics, as we discussed. We want to ensure that we are not being coercive in any way in our transcripts, that we're not kind of coercing participants to provide or leading participants to provide certain responses. We want to maintain non-retaliation and non-loss of self-esteem, right? So we want to really affirm participants' dignity, and we want to affirm their experiences and responses, even if we don't agree with them. And we're not affirming that they're right or wrong. We're not affirming that we agree with them, but we're affirming that that is their experience, that that is what they're sharing. Of course, we want to have adequate privacy protections. We want to protect participant anonymity. We want to mask specific stories or examples if there's a chance that the participant's anonymity could be jeopardized. Of course, we want to use anonymous interviews or focus groups for more sensitive topics, and that can really enable more authentic sharing. And that's the conclusion of this module, module 3. After this, you'll take the module examination, and then we can get started with module 4.